Hi everybody, Dhinu Jayaseelan here. I'm the editor of the independent study courses for the Ortho Academy, and today I got the pleasure of talking to Eric Hegedus, who's a world-class researcher, academic, and clinician. We spoke about pickleball, which for me is a new thing. I haven't really treated too many people with the problems that are associated with pickleball, but Eric actually opened up a fair amount of information for me, which I'm hoping will be helpful for you also as it relates to kind of common injuries that we see in this population, this sport, some prevention options, and maybe some gaps in the research that hopefully can be filled by some of you. So hopefully you enjoy this discussion and looking forward to it. So, hi everybody, Dhinu Jayaseelan, editor of the independent study courses with the Ortho Academy, here today with Dr. Eric Hegedus. Dr. Hegedus, thanks so much for joining us.
Thanks for having me.
So your reputation speaks for itself. Today we're going to be talking about pickleball, but if you don't mind giving the audience a little brief rundown of what you're doing now and how things are going, if you can introduce yourself, that'd be awesome.
Okay, thank you. And thanks for the opportunity. I really appreciate being here to talk about something I'm passionate about. Let's see. What would you need to know? I'm at Tufts University right now. I'm the new department chair of a new department, which is the Department of Rehab Sciences that houses 3 physical therapy programs for Tufts, one in Boston, one in Seattle, one in Phoenix. I'm still treating patients, but I'm at the stage of my career where I'm lucky enough to do that pro bono. And in the last probably 3 years, I have become an avid pickleball player, and a lot of the people that I am treating for free are pickleball players. So I'm sort of familiar with their injury and their passion for the game. Everything else, I think people can find out about me, and it gets boring after a while. So that's probably fine for the intro.
Fair enough. Yeah, I appreciate that. So I'll be honest, because I still treat, I'm primarily teaching, but I still treat in the clinic. And at first, when people would talk about pickleball, I was a skeptic. I was like, what is that? And out of nowhere, it kind of blew up. So can you kind of give me a background on like where did pickleball come from?
Yeah, so invented on an island in the state of Washington by a gentleman who simply wanted a fun summer game for his kids. So they had wooden paddles and a plastic wiffle ball, and so it went from that to a sport that's been the fastest growing sport in the United States 3 years in a row now. Millions of people playing it. I think probably because there's a low cost of entry. To play recreationally, you don't have to be a super gifted athlete. It's for many people, it's a very fun social way to get together. As you get to higher levels, though, the game is already changing to where, so for example, the paddle technology has changed, the ball technology has changed, and the game is getting so fast that people are wearing protective eyewear now because of the speed of the game. So there's a big difference, a big gap between those who play it recreationally and those who play it professionally. And the professional leagues are now all over the United States. There's 3 of those. There's Professional Pickleball Association, the Association of Professional Pickleball, and Major League Pickleball, which is a team sport. And now many of these are in countries all over the world, from India to Australia to you name it. It's just catching fire like no other sport.
Yeah, and I'm 100% on board with anything that gets people active and gets people moving, and I do think, as you stated, there's definitely a spectrum in terms of skill and effort put into it. But I know a number of people have a kind of a perception that it's low impact, low speed, low effort. Can you kind of speak to that, and how accurate is that kind of stereotype of pickleball is not really exercise?
Yeah, so I think again it depends on what level that you play the game. If you're so they divide it into like the lowest levels, like a 2.5 or a 3.0. So it's much like tennis in that in the rating of the players, all the way up to the professionals who are sort of 7.0 and sometimes above that. Um, at the lowest level, it is the stereotype's probably a little bit true. Like, it is not a super active game. It's more active than a casual walk, though. And so again, what I like about it is that even at the lowest level, if you're having fun and you're connecting with people socially, we all know that that's healthy for you. It's healthy physically, it's healthy mentally to not be isolated. So I love that about pickleball. And it is some exercise. And if you get to do it with a group and have fun, then it gets more people exercising. So I love that at the lower level. Now, at the highest level, it's much like tennis. It is rapid pace, it is lateral movement, there's forward and backward sprinting, and there's also singles matches, which are a great deal of exercise. And at, I'm now 60, almost 62. Like, I can play with 20 somethings in doubles, even at a very competitive level. I cannot play with 20 somethings when we play singles. It is a lot more work, a lot more effort. So yeah, it can be very heavy exercise, and very intense exercise.
Yeah. And considering the spectrum, obviously, I know the answer is it depends. But whether it's that person that's maybe out there to be more social, or the higher level athlete that's doing it more for competition performance, you mentioned kind of similarities to tennis. What kind of injuries, what kind of risks do people kind of take on when they participate in pickleball? What do you see?
Yeah, so again, I'm treating that population a lot now. The upside to a low barrier to entry sport is lots of people play it. That's great. The downside to a low barrier to entry sport is people are starting to play pickleball who haven't moved quickly in sometimes 10 or 15 years. And so now they're coming into the sport, many of them with maybe not great balance. And certainly if you look at the last time, for example, happens in tennis too, if someone lobs over your head and you have to backpedal, the last time that some of them have backpedaled has been 30, 40, 50 years ago, right? And so I see the injuries because of that fall into two categories. If this is a person who was a previous athlete, they're susceptible to kind of overuse injuries, and very similar to what you see in tennis, right? There's pickleball elbow, same as there's tennis elbow. There's a little bit of a difference in shoulder pathology between tennis and pickleball, and we'll talk about why that is. There's not as many shoulder injuries in pickleball. You do see low back pain, even in an athlete that's in good shape, because you're running, changing direction, and bending rapidly. So you see low back pain. And you see some other sort of nagging kinds of injuries like Achilles tendinopathies, and things like that. The other end of that spectrum is the people who have come in and they're just learning to play the game. And so what I'm seeing is they're largely sort of 55 and older. And when I see them, the first thing I screen for is, and first thing I suspect is fractures often, or a concussion. And so what happens, this story I've heard more than once, is I was backpedaling and tripped and fell and smacked my head, or I was backpedaling and caught my foot and I put my hand down and they have a wrist fracture, or fracture of one of the bones in the hand, right? And so you have to be kind of aware of that as you treat them. I've seen hip fractures playing pickleball. And so that group that is not used to moving rapidly and running backwards and all of those things that happens when you play, it's more traumatic. Achilles tendon rupture, for example, can happen also.
Right. And I mean, speaking to that kind of piece, going back and forth before this kind of discussion, we were talking about how there's not too much research out there related to pickleball.
That's right.
So obviously we can extrapolate from other kind of sports that might have similar types of movements, demands. But in that sense, do you feel like there's anything, whether it's evidence-based or anecdotal or whatever, that might be helpful in terms of prevention of injuries? Is there like a screening tool that we can use for this person that maybe is not as active, that's starting to get into it? What do you think?
Yeah, no, I think it's a great question. And so the warning here is that a lot of this is my opinion based on seeing this group of individuals, and not because it's been in a randomized controlled trial or a great epidemiological study. It's none of that stuff. Those studies are coming, but they're not out there yet. And definitely not in the United States, where there's the largest number of pickleball players, right? And so, what are the risk factors / how do we screen for it? I would say in the 55 and older group, clinicians would think about, so where are they vulnerable? So I think it does go back to some sort of balance test, some sort of agility test, maybe a shuttle run. I think we're starting from scratch like we did in many other sports. And again, might we find out later that they lack validity or responsiveness? Yeah, we might. But I think you're at this point, that's what you should be thinking about is, can they change direction? Can they sprint quickly? Do they have good lateral movement? And so I think there's some things out there like balance testing, single leg squat testing, agility testing. In the younger group, mostly, again, they're relatively fit anyway. And so the screening tests, for me at least, haven't shown too much. So I haven't seen a great pattern there where I would suggest, okay, in this younger group, so what do you test for? Largely, I see overuse because they discover pickleball, they get addicted to it, and then it's the same stuff that's in tennis, right? Okay, you played for 6 hours, 3 days in a row, and you wonder why your hip or your wrist or your elbow hurts, right? So I don't see many screening things. Again, I see risk factors, though. Again, I think you would have to say that age is a risk factor. I think you would have to say that decreased balance agility is a risk factor in the older group. In the younger group, again, I would say largely what I'm asking them, whether it's an actual screening tool or not, is how active have you been in other sports up till now? And some of them will say, well, I've been playing tennis and now I've added pickleball. And so those folks are usually okay. Some of them will say, well, I played tennis in college, but now I'm 45 years old and I'm picking it up again. So in those individuals, to me, that's a screening question that I say, okay, so my assumption is you're not super fit unless you tell me you've been lifting weights, running, doing something to stay fit. So for me, that's a screening question of what have they done before and when's the last time they were physically active in that younger crowd. And then I like to know how long they've been playing and if they've had coaching also, because like in tennis, if you just pick up tennis and play it, sometimes that elbow or shoulder pain is actually poor technique, can be a handle on your racket, in this case for pickleball, a paddle that's too small or too large for you, that can cause like some elbow and wrist extensor pain. So that's kind of what I look at in these two sort of groups of individuals who play pickleball.
Yeah, I mean, I think that's kind of true across the spectrum of sports and participation, is that older population, we have a fear of them falling, and when they fall, they're going to have these major macro trauma kind of injuries, but we don't necessarily suspect that as frequently in our younger population that has more of these overuse population or types of injuries. One thing I heard you say earlier was that the shoulder pathologies maybe are a little different between pickleball and tennis.
Yeah.
And
pickleball is not an overhead sport. Largely, you certainly can hit an overhead, and people do that. But most people don't injure their shoulder in tennis hitting an overhead or two. It's the repetitive serving that happens that they have shoulder issues with. What in pickleball, the serve is underhanded. And this is a major difference between the two sports, which is in tennis, the server has an advantage. I don't know what the percentage is, but servers, if they're equally talented, win a large percentage of the games when you play tennis. That is not the case in pickleball. The serving team is on the defensive because the ball has to be served underhand and it cannot be struck above waist level. So you are basically hitting the equivalent of tennis in many cases to a top spin ground stroke is the way you're serving. So there's not much overhead activity other than there are occasional overheads that you hit. They are largely to get yourself in a position. That's the other thing that changes between pickleball and tennis is in tennis, if you can get set up for an overhead, you can win that point. In pickleball, when you're hitting a wiffle ball, you may have to hit 4, 5, 6 overheads in a row. That's not really how you win points in pickleball because it's a plastic ball that doesn't ricochet out of play. It's very playable when you hit an overhead, and so angling the ball is far more important than how hard you strike an overhead in pickleball.
So then if maybe we're not spending as much time overhead, when I'm recovering this person that wants to get back to pickleball because let's say they have an overuse injury, and again, like obviously we're thinking more macro level versus everybody in front of us is going to be specifically requiring a different recovery process. But what are some kind of activities or exercises or muscles you think maybe are more relevant for this person that plays pickleball more frequently compared to our swimmers or our tennis players? Like, what do we want to try to focus in on or at least not miss?
Yeah, so I think, again, my first focus would be lower extremity in the pickleball players, right? I think we need to make sure they have the requisite strength, but also stiffness in the calf Achilles complex. And I use stiffness in this case the way exercise physiologists use stiffness, that ability to absorb that force in through the Achilles tendon and then use that to propel yourself forward without causing injury to the calf or the Achilles, right? And so I think that's a big deal for me. I like to make sure that they have the requisite hip strength that they need also. I've seen more than one tennis player who adds 3 hours of pickleball to their day after they've played 3 hours of tennis, and pickleball's largely played on concrete. You don't see it play on many other surfaces except concrete. I've seen more than one labral tear in the hip as they fatigue and don't have quite the endurance in the hip. So my first focus is always for them on sort of lower extremity things. Second would be probably lumbar spine and everything that we need to do with that in a sport where, just like tennis, you know, that they're trying not to hit the ball at a level that's comfortable for you. Your opponent is. And so many times there you are ready for an easy volley and they're hitting it at your feet as you're running forward, right? So you're running forward while you're flexing rapidly and decelerating in your lumbar spine. And so you have to be ready to do those things. And so, for example, I know a lot of physical therapists work on stability, and I'm not knocking that. But if we define stability as the ability to control the lumbar spine through a range of motion, I'd be more thinking about, do they have the eccentric strength that they need? And same with hamstrings as they sprint forward and then bend rapidly. So having them work on a mat where they're doing abdominal drawing in and those sorts of things is not anything that is really going to help prevent injuries in pickleball, nor is it going to help them perform better. We have to think about that motor control over that large range of motion that happens. And I guess finally, I mean, just to be comprehensive, do I occasionally have them exercise shoulder, elbow, wrist, hand? I do, but if we're talking about a preventative program and they're not coming with any sort of pain, largely they're okay there, right? The paddle itself isn't super heavy. The ball itself doesn't cause a great deal of reverberation in the arm and hand like it does in tennis. So if they come in with that pain, of course I treat that, and then we strengthen and create the mobility that we need to. But it's the third thing I think of with many of the pickleball players as far as where do I need to exercise them.
Right. Yeah, I think that for me as a clinician, that's super helpful because I think sometimes if we're going on both sides of that spectrum, that older person, sometimes we have a tendency to underload them,
Yes.
and we often underload them with things that are more predictable, like exercises on a mat or exercise with a machine. But this person has a problem with dynamic control oftentimes, and so return to sport needs to be a part of their recovery too, or their performance activities. And
Yeah, I
so
couldn't agree with you more.
challenging everybody, I think, is important, and not just the younger person that seems to be more athletic. Um, what kind of advice do you have? Let's take it away from the clinician side of things. Let's say pickleball players are watching, and they want to know what are some ways that they could enhance their performance without seeing a PT or without seeing a personal trainer. What are some ways that they could kind of get better at that sport without some guided support?
Yeah, so I think there's two ways. Number one is on the physical side, fitness, and maybe three ways. Number two is the mental side, and then number three is skill side, right? And so the skill side does involve, there are certain shots in pickleball that you need to be able to hit that's different from tennis. That's the other difference in pickleball is you cannot come all the way to the net. There's sort of a 7-foot space between the net and your side of the court where you actually can't hit the ball out of the air there. And if you do, it's a fault. So they call this area, I don't know why they ended up calling it the kitchen, but they call it the kitchen, which is a really weird term. Most people call it the non-volley zone. So you can't hit the ball out of the air there. So there are certain skill shots that you need to have for pickleball to be able to drop the ball from any part of the court into that 7-foot space is super valuable. And it takes hours and hours and hours of practice, even for good tennis players, to drop the ball there over and over again consistently. If you do that, it allows you to get right up close to the edge of that line. And once all four players at the net, the advantage that did go to the returning team is now lost. Once everybody gets up there, it's game on. So there are certain skill shots that you need to have. Good tennis players will come in and have all of the ground strokes that they need. So they have an advantage for sure. Some of the best players, though, do come from other sports like racquetball, like basketball. And so there's that skill component. I would say when I came into pickleball even 3 years ago, largely your coaching could be found on YouTube, and it was hit or miss. Sometimes the advice was terrible, and sometimes the advice was really good. And now there are absolutely coaches in the game. There are physical therapists now for the professional players because they realize the need to stay fit. And that takes us to the second thing, which is this level of fitness that needs to be there. And if it's not with a PT, I largely think whatever you like to do to work on your endurance is fine. Again, there's not, I don't believe, a direct translation between, for example, running 5 miles and playing pickleball. I'm not sure that's training the same systems, but I'd rather have them do that than nothing. And then I think strength training for me is the most important thing they can do physically if it's not with a PT. Like if they just want to do general strength training, I think that's a fantastic idea. Now, I also personally am a large fan of stretching, even though I know the literature about, hey, it probably doesn't prevent injury. We're not sure exactly what effect it has. I happen to personally think active warm-up is a bright idea. I happen to think that in your cool down, stretching is probably a good idea. And I say that as somebody who's now 61, and after the game, my range of motion is absolutely not normal. I'm stiff and arthritic and old, right? And so stretching is important. And then the last part is the mental part of the game. I don't know. Some pundits in pickleball have called it chess because there's a lot of subtlety. There's a lot of sort of cat and mouse at the net about where you're hitting the ball. The best players disguise where they're going to hit the ball because as you get better and better, if you if you play with the same pattern consistently and the other team figures that out, it doesn't work well for you. You're going to start losing consistently. And so there's a lot of disguising of the shots. And then again, the new paddle technology allows you to put some wicked spin on a wiffle ball, which is basically what it is, hard plastic ball with holes in it. So that there are some mental processes you need to go through to keep yourself confident, skillful, able to play under pressure, same as every other sport.
Sure. Yeah, I'm learning a ton just listening to you talk about it, because I treat people with sport-related injuries a lot, and I see some people with pickleball injuries, but not frequently. And I'm gonna guess that based on the population playing, I'm gonna see more and more as time goes on. And obviously, having this discussion is helpful, but I also, from a research perspective, I'm always going back to the research side of things, and obviously you're a researcher too. What don't we know that we need to know? Like, where are the gaps that need to be filled, do you think, in the pickleball literature that we should try to prioritize as clinicians, researchers, academics?
So it is literally wide open. Any kind of, you could start with any kind of cross-sectional study that for a large group of people reports injuries for a season so that we can catalog those. You could do screening research. You could do risk factor research. There is an absolute shocking lack of any data collection at all in this group, despite the fact that there are so many people playing it. And so anywhere that you want to wade in to this from a research perspective is fantastic. Everything from prevention to, again, cross-sectional studies to risk factors to you name it, to treatment, to any of that stuff is wide open. You would, by your third article, you would be the leading publisher in pickleball literature.
Why is there such a discrepancy? Why hasn't research caught up with that?
I think, when pickleball first came out, it was kind of like, first of all, what is it? It's really weird. It has its own terminology. It's probably not a very skillful sport, and you don't have to exercise much in it, right? And so people were like, pickleball, really?
That's kind of how I thought, to be honest.
Yes. Well, the first time my wife said, let's go play pickleball, I'm like, I'm not that old yet. I mean, it was a terrible thing to say, but I'm like, I'm not playing pickleball. Well, and then once you play, of course, you become totally addicted to it. It's a total blast. So I think that's it. I think it had this reputation as a pretty easy sport that anyone could play. And now, the PPA Tour has its own physical therapy group that follows them around every weekend, right? So it's turning into tennis. And I think what happens first is we learn to treat this population clinically, and then what follows that is the research. And so I think that's why. I think now is the time, and if anyone out there is listening who is part of that physical therapy trailer that travels around, now's the time to start gathering the data. Do more than just treat them and give them what they want, because I do see some of the pros wearing kinesio tape but anyway, start collecting data on these injuries and how we prevent them, and we just haven't caught up yet.
Yeah, and we'll get there, and I'm sure there's going to be a number of studies coming out which will, I'm sure, support a lot of what you're saying, maybe give us some surprises, but obviously there's a lot to learn, and it sounds like an awesome sport. Anything that we're missing, any parting shots that you wanted to talk about or kind of speak to as we're kind of closing out here today?
Yeah, no, I mean, the thing that you allowed me to talk about earlier, which I think is really, really important, right? We're seeing how damaging isolation can be to an individual's health. The beautiful part about pickleball is you become part of a community of individuals. That might be the best part of it. It's I don't think throughout my lifetime I've ever had as many friends as I've had since I started playing pickleball. And when somebody comes from a whole nother state they know where we play good pickleball, and so they come there and they're welcomed, and everybody's, and we get each other's numbers, and it's just a really good community. For whatever reason, so far, pickleball has not let itself lapse into sort of an elitist attitude where, oh, you're a beginner, you're not worthy of playing with us. That seems to not be that way in pickleball. It seems that people just go, oh, okay, welcome to the sport. I hope you like it. Let me know what you want to know about it. I can give you some hints if you want, or I can keep my mouth shut while you learn on your own. So I think that's the beauty part of it, is this. There are maybe unintended health benefits. I would say they're intended for me, but for many people, they do not realize how healthy it is for them to be around individuals who enjoy playing the game. And it's causing people who didn't exercise before to exercise every day, which is also magnificent, right? So that would be my parting shot. Yes, is it physically demanding? Yes, especially if you play singles, and especially as you get to higher levels. The great part is this lack of isolation that happens, this community that you become part of, that's an absolute blast, and you can take that community anywhere. I went to Florida to visit some friends, and I was like, well, are we doing anything this morning? Because if not, I'm going to the local pickleball court. I was welcomed immediately. They told me how their system worked there, played pickleball for like 4 hours, and met great people and had a blast, and then went on and did other things. But so that's what I would say. If you haven't tried it, it's worth trying.
Yeah. And anything's worth trying to get you active, and anything's worth mentally and psychosocially keeping people healthy, not just physically. And if it can do both, that's awesome. And I appreciate you taking the time to chat with me and teach me about it. Definitely kind of changed my perception a little bit. Hopefully helps the audience and the membership kind of know a little bit more about it. And hopefully we see some more research come out to kind of guide our practice a little bit better, so that we can take care of these people a little bit better too.
Yeah, great. Thank you. And thanks for having me. And thank you for I loved your questions, by the way. You're an expert interviewer. Questions should flow from a conversation like they do in clinical practice, as opposed to a list of pre-recorded questions that we ask. So you did a great job today of just asking questions because they made sense to ask those questions. So thank you.
Of course. Yeah. Thanks for taking the time.
Yep.
All right.